Okay, if blood pressure rises due to anxiety or stress, but then comes down to a normal level later, if this happens maybe multiple times throughout the week for different situations, is that a problem?
That's again a very, very good question. The question is, what happens if the blood pressure goes up due to anxiety and then comes back when you're more relaxed? But what happens if you're having several episodes of that throughout the week? Is that a problem? The answer is yes and no. The yes is because every time your blood pressure goes up and down, up and down, up and down, it's a problem. Just as I told you, the garden hose mentality, right? Every time you open the tap, close the tap, open the tap, close the tap, open the tap, close the tap. It's a problem. But how do you get rid of it? You actually already asked, you told me what the problem was, and you already know how to get rid of it, right? So it's not with blood pressure medication. I've had some people who come in, the blood pressure is 220, they go home, the blood pressure is 120. How do I know that? They have ambulatory blood pressure monitors. You can actually put it on and you can go home with that monitor and come back and you'll be 200 in the clinic, and as soon as before they come into the clinic, it goes back to 190, 200. Pure anxiety. Now the rule of thumb is if you're taking more than 3 or 4 blood pressure medicines, the blood pressure is not controlled still, there's a problem. You have to make sure it's not due to underlying anxiety or social stressors. So if you're having repeated episodes of that, both at home, at work, and when you go and see the doctor, okay, now it's not supposed to be normal. If it's only what we call a white coat hypertension, but to be purely white coat hypertension, every time you come in should have some kind of a reaction, and your ambulatory blood pressure monitor should be completely normal everywhere else, you don't need any treatment. But if you're going home, you're stressed, blood pressure's up, right? You're going to work, your blood pressure's up. Then what happens is it doesn't matter what's causing the blood pressure, your blood pressure is up. So either you take blood pressure medicine, but guess what? Every time you come home and you relax, you're going to go down to the dumps and you're going to be falling asleep and you'll be really, really tired. So what's the answer? You have to take care of the problem. The problem is anxiety and social stress. So you have to do whatever it takes to relieve it. So we've had several patients, not several, but a few of them, where instead of putting them on blood pressure medicine, I take them off and put them on anti-anxiety medicine. They're fine. They don't require. As I said, I've had some patients who I've used maximum doses of 5 medicines and nothing touches them. Guess what? It's secondary to anxiety. And I took them off all the medicines, put them on a mild anti-anxiety medicine, blood pressure is totally normal. So in reality, that's you for anything in medicine, cardiology, blood pressure, cholesterol, whatever it is. The goal should always be diagnosis. Try to find out what is the cause of it. The goal should not be, hey, what can I do just to send you out the door? That's where personalized medical care comes into play. So if I don't analyze your blood pressure and find out what's causing your blood pressure, then I'm not doing you a service, or I'm not giving you optimum medical care. I'm just basically running a business. Basically, hey, you have insurance, I'm going to charge you for it, I need to make my home payment, and that's about it. Am I right? But in reality, the diagnosis and the cause and find out the etiology of your medical issue is ultimate. Otherwise, there's no way you can treat it successfully either. So you'll end up going to the doctor every 3 months for no reason. You'll be taking 5 different medicines for no reason, and then you'll be feeling horrible for no reason. So it's kind of a vicious cycle. So that's why I'm a strong advisor of we have to sit down, talk to the patient, know what is causing your blood pressure, and what all we can do to prevent that. Does that answer your question?
Yeah, that was very helpful.